Welcome back to Wisconsin Tonight. Well, there's a big push to get people to take advantage of Medicine Collection Day. It comes up this Saturday.
Now they're trying to get people to get rid of prescription medications safely.
And joining us now, Dr. Michael McNett, supervising physician for the Aurora Comprehensive Pain Program, also a member of the Medical Society of Wisconsin, or Milwaukee. Thanks a lot for joining us.
My pleasure.
Yeah. You know, some people call the prescription drug abuse problem in our area an epidemic. Do you see it as that, and how did it get that way?
I think it's a major problem. I don't quite know how to define epidemic, but I'd say it's a big enough problem that it really requires a lot of attention. I think when I went to medical school, back when we were using clay tablets for our medical records,
not that long.
Really, we were all taught just to avoid narcotics, and a lot of patients suffered needlessly. And so in the late 90s, there was a big push to try to do a better job of taking care of patients' pain. Unfortunately, in trying to do that, a lot of patients who are prone to addiction were exposed to opiates and developed problems. And now we're dealing with the aftermath.
Yeah, let's talk about that. People exposed to pain medication and then they go on to use heroin. How does that happen, and is that common? Are you seeing a lot of that?
It is unfortunately too common. And what happens is a person who, let's say a person's prone to addiction and they get exposed to a narcotic, it starts with them just liking it. And so when they should have gotten over their medical problem, they don't. They continue taking the medicine, they continue complaining. Then they go on, it becomes worse, the doctors start becoming suspicious, they cut them off their narcotics, so they turn to street drugs. And actually heroin is cheaper than than street oxycodone.
And that amazes me, because that's just a recent phenomenon, isn't it?
It is. I think it's a supply and demand thing.
So tell us about Medical Collection Day. That's coming up this Saturday, right?
It is. And I think it's a wonderful thing, because you don't want these drugs lying around in your medicine cabinet or in a purse, because you never know who might find it there.
Right.
And it's not just narcotics, it's other prescription drugs too. These drugs have serious side effects, and if some child were to find them, it could be catastrophic. So I think finding a way to safely dispose of it where it won't go into our water table is a very important thing.
Yeah,
so
don't
what
just
should
put it in the toilet and flush it.
Dangerous.
You know, interestingly, in New York, they've found actual detectable levels of these drugs.
Is that right?
Which is probably why they're so well hydrated.
That's a good point. Now, Dr. McNett, what do people need to do if they're planning on disposing on this medical day?
I think getting all the medications that you know you're not going to be using and going to one of the collection sites, which will be available on the website, they just take it down there. It's totally anonymous, and you can get rid of them there, and they will be disposed of safely.
Good way to do it. Dr. Michael McNett, we thank you so much for coming to join us.
It's my pleasure.
Thank you, sir.
And you mentioned the website, because we put more information about the Medicine Collection Day on our website, tmj4.com/Wisconsin Tonight. You can find out exactly how to do it.